Andrew Yang. What an interesting character this man has been. I've talked about him quite a bit, and unfortunately, what he has turned out to be is what I expected him to be, and we will get into that in a second. But it turns out that he's a complete liar, basically, which is really concerning for me personally, because if you're going to lie about something like healthcare and you're going to lie saying that, oh, I support Medicare for all, and then you just don't support it at all, how can I trust you on literally anything else that you say? That's such a key proposal, right? If it was some random minor proposal that was not very relevant, okay, that's one thing. But when you're talking about Medicare for all, your health insurance plan, which is, for me, the biggest thing because health insurance is life or death, so it's the most important issue, I can't trust you on literally anything. So there was this article posted in HuffPost titled "Andrew Yang is the most conservative healthcare plan in the Democratic primary" by a guy named by the name Daniel Morans. And he breaks down how it's actually the most conservative plan within the Democratic race. So it says, in fact, Yang's health plan, which he bills as an iteration of the left's preferred Medicare for all policy, is more conservative than proposals introduced by candidates typically identified as moderate. So it explains, in terms of expanding health insurance coverage, Yang says on his website merely that he would, quote, explore allowing the employees of companies that already provide health insurance the chance to buy into Medicare. Quote, we need to give more choice to employers and employees in a way that removes barriers for business to grow. So, it says under Yang's plan, people employed by businesses that do not provide insurance or who are self-employed would continue to purchase coverage on the exchanges created by former President Barack Obama's Affordable Care Act. So, what you're looking at basically here is a sort of, public option type of thing at this point. But, he has the whole explore stuff, which is really embarrassing. It says, as president, I will explore ways to reduce the burden of healthcare on employers, including by giving employees the option to enroll in Medicare for all instead of an employer-provided healthcare plan. Now, this is a bunch of mumbo-jumbo right here. First of all, the explore garbage is a hogwash piece of trash. Also, saying that you'll give them the option to enroll in Medicare for all is incredibly disingenuous. Then it's Medicare for those who want it, not Medicare for all, okay? That's not how it is. So, and then I also want to just say that, the best way to remove, I think that small businesses, right, who have 50 employees or more, I don't think that they should have to pay for healthcare costs for their employers. I really think that that's terrible. It's way too much for small employers to burden. And so that's why I favor Medicare for all. We can stop that system in which they don't have to do that because it's a very high cost. And so when people act like that's not what's going on with Medicare for all, it's ridiculous to me. But, after reading through this whole thing, he's not addressing the key issue. And this is also concerning to me. The key issue really is, do you support Medicare for all, which he says he does on this page, in spirit, is what he says. But, in here it doesn't say anything about, I'm going to establish a Medicare for all system in which everyone has free access to it. It doesn't say anything like that. There's no clarity here. It's very vague about that. And a lot of these proposals that he has are good, but they're already included in a lot of these other healthcare plans, trying to cut costs. But bringing it into a single-payer system would bring the cost down. That's how you bring costs down in the first place, by not having, price gougers like the private insurance companies, obviously. So, it's ridiculous. It says, to be clear, I support the spirit of Medicare for all and have since the first day of this campaign. So it's he doesn't support Medicare for all, and this is very, very disingenuous on the part of Andrew Yang. If you watch his convo with Ben Shapiro or Mike Figueredo from the Humanist Report, and you saw him on, I forgot if it was CNN or MSNBC or something, where the host, basically is like, hey, you don't even really seem to, support Medicare for all. Why on earth are you claiming to support this? And he's like, yeah, I don't. So, he's been disingenuous. I've been saying this for quite a while for you folks, okay? I've been saying this for quite a while. He doesn't support Medicare for all. It's a fraud. And again, to repeat, if you are lying to me about one of your most crucial plans, right? For me, it's the number one. For me, healthcare plan is the number one issue, okay? then how can I trust you on anything else? Mind you, this is also the guy who doesn't support a federal jobs guarantee. He wants to sunset all regulations after like 5 or 10 years or something, which is completely embarrassing, by the way. I mean, just complete insanity. But like, are these proposals here bad? No, they're not. But all of these things can be included in a Medicare for all system. So like, he talks about comprehensive coverage here. But my thing is like, you're talking about comprehensive coverage, but how, like, that doesn't address how you're going to get that coverage to people. Now, so the Yang stands who are going to, if Andrew Yang came out with a dick pic, they'd probably all upload their own, just to stand in solidarity with him. So they're going to defend him, but their defense is basically, oh, well, he's doing a systemic change so that it's cheap enough for people to buy. First of all, you would have to get rid of the price gougers in the private insurance companies to do that, first of all. But number two, that doesn't address, like, no one can pay out of pocket for health insurance. It's impossible. It's literally impossible. So you're not addressing, how you're going to give, and there's nothing here about expanding coverage to people who don't have it. There's just simply nothing here on that. There's nowhere does it say where, there's, you've 100%, I'm going to give this free option to everybody who doesn't have insurance currently, who's poor. Like, it just doesn't exist. It's not on here. So it's really remarkable to me. But, are some of these things bad? I mean, I agree with most of this stuff. Like, even, it says ensure comprehensive care includes vision and dental services. Okay, but who has access to this comprehensive care? Is this comprehensive care a public option? Are you insuring it to everybody who can't afford it, who doesn't have it already? There's nothing here that really says anything about this, and this is super unclear, and it's very confusing to me. I really don't know what's going on with this, but it's really shady and really shifty, I have to tell you. It talks about controlling prescription drugs, which obviously is a big thing we need to do, right? Obviously. So it goes on. It goes on here to say that the decision not to focus on expanding coverage distinguishes Yang dramatically from his competitors, and in the foreword to his plan, he explains that is a deliberate choice, since enacting single-payer healthcare is, quote, not a realistic strategy. We are spending too much time fighting over the differences between Medicare for all who wanted, and ACA expansion, when we should be focusing on the biggest problems that are driving up costs and taking lives. We need to be laser-focused on how to bring the cost of coverage down by solving the root problems plaguing the American healthcare system. So, I am all for this. I am all for attempting to systematically bring down costs of our healthcare system. But the biggest thing of that includes a single-payer healthcare system. That's how you can bring costs down. Get rid of the private insurance price gougers. Get rid of them. And then you negotiate drug prices like they do in Canada. We need to incentivize more doctors, make medical school free. I believe we should make doctors' income tax exempt because the job that they do is just such an invaluable job. And it's another incentive because they're taxed. They get kind of hit hard by taxes. So, probably eats like 100, 200K of their income when we need doctors. And they definitely deserve that. So I think they should be tax exempt completely. But all of these different things we can do under a Medicare for all system, and it is what we're going to do. It's a full throttle scenario. But none of this is going to give poor people insurance. It's simply not going to do it. It says, when asked about how Yang plans to expand health insurance coverage, 27 million Americans remain entirely uninsured, and millions more have insurance that is so threadbare they do not use it. Yang's campaign referred HuffPost to his website. So it says Yang would increase healthcare access through reforms designed to reduce healthcare systems' underlying costs, according to his campaign. So again, like, this is simply not going to do it. This is stupid. This plan is embarrassing, okay? And I'm really livid about this, although I'm not surprised because I knew this was coming, to be quite frank with you. I knew this is who Andrew Yang was. I knew it. I'm not going to lie. I've been telling you guys this for a bit. This is Andrew Yang. So the question we have to ask now is, who the hell is Andrew Yang? I don't know who this guy is. All I know about him is he supports a universal basic income. But that's all I know. That's really all that I know at this point. And for all I know, this guy could be basically the next Milton Friedman. and it's disgusting to see, and I'm totally done with this guy. Even though I find him to be kind of a funny character, and not someone you'd want to hate, it's pretty slimy what this guy did. Like, it's one thing to be, like, I always said that, I always had this level of support for, or not support, but respect for Amy Klobuchar, because I told you guys, she may not agree with Medicare for All, but at least she's honest about it, and I respect that. If you're going to be a centrist, go out there and be a centrist. Don't lie to people. Don't make stuff up. Don't do any of that stuff, all right? Don't be like Kamala Harris and you fake your positions. Hold your positions, take them, be public about them, and that's that, basically. So this is very, disappointing and unfortunate.